Right. Good afternoon, Jackie. It's really nice to see you.
Nice to see you, Rob.
Yeah. I was just thinking about this the other day. I think I've probably known you now, Jackie, for about over 4 years. I think we first met at the Leachmere Centre over over near Hope Park. I think I came down one time to a meeting. But obviously, I've known you as the Community Public Health Practitioner, which is your official title, isn't it? And you work.
It's changed now. It's changed
Is it?
again.
Oh,
Yeah.
really? What's it now?
What did you just say? Community Public Health Practitioner.
I did, yeah.
Oh, yeah. Sorry, that's the new
That's
one,
right,
yeah.
is it? Yeah. Well, the thing is, though, Jackie, is that you've got these titles, but really, I know you as the best networker around. I mean, it's actually your networking ability. And I mean, I think you're fantastic at your job at networking, bringing together people. As you said earlier in a conversation we had, you're a real people person, and
I am.
Yeah, and what I've seen in your work is your ability to bring together different bodies and organisations to work together for the interests of Sunderland.
Yeah, definitely.
Yeah, and so now is as good a time as any to talk a bit about that, and also about how important it is for us to work together to support people in Sunderland during this time. And but first, Jackie, I'd like, if you don't mind, if you could just say a bit about yourself, because you're not a local lass, are you, originally?
No.
I want to tell you a bit about where you come from and how you came to be here in Sunderland. That's okay.
Well, I've been in Sunderland now for 32 years. I moved up when I was 19. And when I came to Sunderland, I had no qualifications. So I decided to do an access to university, and then my journey started then with education. So I've been in Sunderland for 32 years. So what I say I am, because I am originally from Salford in Manchester. So I always say that I'm a Mancunian Mackem, because I've actually been here longer than I was in Manchester. But I'll never forget that I am from Manchester, and I'll never totally say that I'm a Mackem. I'm a Mancunian Mackem, although my husband said there's no such thing. But there is, because I'm one of them. So like I said, I've been here 32 years, and the reason why I came up is because my sister had already moved away, and she didn't have any help with childcare. And I was young and didn't really know what I was doing myself. And I said, I'll come up and look after my niece. My niece now is 30, she's 33. She's got 3 kids of her own now, but I came up to look after her because my sister worked full-time and her husband did as well. And then eventually met my husband, Kevin, and then settled down myself, but then decided that I wanted to do something different. I knew I loved working with people, so I did my first degree in community and youth work, because I'm all for the people's rights, and that's what my passion is, about involving people and getting them involved with whatever's happening to them instead of the people doing it to them. So I've worked in the voluntary sector. I worked in the NHS for 10 years, and then with the government changing, they moved us into the local authority. 7 years it is already. And I tell you, being took out the NHS and being put in the local authority was a real challenge in itself, because when you join the NHS, you join up and you want to stay there for life because you feel that you're making a difference. Yeah. And when I first went into the local authority, I was a bit unsure, but then now I've been in the local authority 7 years, and I can make such a difference in the local authority, because public health can influence so many things across a life course, across a person's life. And when you're in the NHS, you can't do that as much as you can do it in the local authority. So I was in public health for 12 years, and I love public health, and I'm really passionate about improving people's health and tackling health inequalities. But I didn't feel like I was in the right place in the local authority. So I've recently been seconded into a different part of the council, and it's called the Community Resilience Service, which is right at the grassroots, really supporting local people. And since I've been in that team, which I think I was in it 2 weeks, and then we got COVID, so I've moved at the right time, because I've been very much involved with the community hub arrangements that we've got, the virtual hubs. So we've got 5 community hubs across the city now supporting people. And for me, I get really excited and feel really positive because we're actually getting in touch with people that we've never been in touch with before. So after this COVID-19, I get really excited about us being able to maybe make a difference in people's lives in terms of isolation and loneliness, because that's what I've done a lot of research in.
Yeah, I mean, one of the things I've really noticed, and because you run this welfare network, haven't you? Which I've been involved in, and
Sunderland Wellbeing Network, yes,
Wellbeing
yes,
Network,
and that's came with me because they see it really valuable within the community resilience team. So that's, although I've moved out of the public health team and moved into a different team, I've also brought a lot of the work with me that I was working on. So I was working on isolation and loneliness. I've still got that in my portfolio. I was working on the Sunderland Wellbeing Network, and that's came with me. I was also leading on isolation and loneliness, and that I will continue to do that. I'm also the lead for the City for Age Friendly when I was in public health, and that's came with me as well. So what I'm busy doing now is designing plans with the neighbourhood team to get age friendly, because we've been an age friendly city for about 7 years, but nobody knows about it. So what I'm hoping after COVID-19 is that we can really, really make a difference at a neighbourhood level so that we are age friendly. And I've got the buy-in from the neighbourhood team. They're all wanting to get, and although I am in a different team and I've only been seconded for a year, I'm hoping that I can stay in this team, because what I've took on as well since coming to this new team is really leading Crowdfund Sunderland. Have you heard of it?
No, I haven't actually, no.
Well, Crowdfund Sunderland is a...
Sorry, I have heard it, yes.
Yeah, so Crowdfund Sunderland, I've been really leading that, and I've still been working on it since I've been in COVID-19, which is great. So this week we're going to be awarding projects funding, and it's projects that communities want. So we're always grant, and it's another way of grant funding. So I'm involved with my manager and the CCG, and we've assessed the projects, and what we do is that we pledge money towards their projects, but they have to get 20 backers from the community to make sure that it's what the community want. So there's going to be a press release today, so I can't say much more about that, but when the press release comes out today, you'll see that we're going to actually award projects, and I've already set up another meeting for next week to assess more projects.
Brilliant.
So I think it's a real drive for community engagement and involvement. I think doing things and giving funding to what local people want instead of thinking what they want.
I think one of the things what really struck me, Jackie, is that first is that it's really interesting that you moved into public health from the NHS the time that you did, because in many respects it's turning full circle, and public health is beginning to recognise that we need to sort things out in the community. Because obviously the virus we have at the moment is being sorted out in the community. Yes, the NHS is really important, but actually it's the community and the community resilience within the community that matters. And
definitely.
And I think part of the issue is, of course, is that Sunderland's been hit very hard by the virus, hasn't it?
But a lot of people are saying that, and it's on the news saying, Sunderland's got the highest deaths and that, but you need to remember that we've got very high health inequalities in Sunderland. We've also got a very high population of older people as well. So we've had health inequalities in the city for such a long time. Of course, it was going to hit us. There's no getting away from that. But I think after this, it'll make us stronger. It'll make us more resilient. We've actually recruited over 1,000 volunteers on the council volunteering hub. We're also helping over 1,000 people. I mean, I'm even signed up as a volunteer myself. And because I don't work on a Monday, and me and my husband are going shopping every Monday for a couple round the corner who are 83 years of age and haven't got any family. So we've been doing that every week. And when I went this week, the little old man said to me, "Jackie, I'm sorry, it's just going on." I went, "Don't worry about it." I said, "I've signed up as a volunteer to do this. I don't work on a Monday. You're not putting me out. It's for an hour." We quite like doing it, me and my husband, because we feel like we're looking after somebody. So it's not, we don't feel that they're doing, that they're driving us mad. He said, "I've got more shopping this week though." He said, "It doesn't matter how much shopping you've got, and it's just, he said, "But I grow tomatoes and I've got no it called for the garden?
What's the compost?
Yes, compost. And I said, we'll get you a bag of that as well, don't worry. So we got it. And he said, you're strong. I went, it's not me strong, it's my husband. I'm not strong at all. He's carrying all the bags.
So I mean, yeah.
Even though I'm working full time, I can still do an hour a week volunteering, which makes me, I mean, and my husband feel really good. I had to work over the bank holiday weekend, and it was only the first week into COVID-19, and I said I'd work on the bank holiday Monday, and I thought it would be like, oh yeah, I'll just be sat here doing now. Well, me and my husband were out delivering 9 food parcels all around Sunderland, from Easington right up to, you know, Hilton Castle, all over the place. Yeah. And my husband keeps saying, can we deliver it? Because my husband's been furloughed, so he's absolutely climbing the walls while I'm working all day.
So it's a release.
He's doing all them jobs that he's never done.
Yeah. But, I mean, one of the things I like about your work, Jackie, is I mean, as you've just been describing, you put your money where your mouth is, and you talk about it. You set up systems, but you also go out and do it as well. Yeah. And I think those examples of that very much in those. Remember, we had those wellbeing days, didn't we? Where and where you had local organisations and local groups coming together to celebrate what they did together. Do you want to say a bit about that? Because I think this has really been
so
happening, isn't it?
We will continue to have them after this has happened, because we've already secured the funding to have these. So we were supposed to have one on the 6th, I think it was the 16th or the 18th of April, and that was our next one that we were going to have in Washington. So we will have that after this is all over. So they're called connectiveness events.
That's right.
And the overall idea of them is to bring local people, and I mean Mrs. Joe Blogs off the street, not organisations, to bring local people together to let them know what's going on the front door. So we had one in the last one we had was in the coalfields. And the coalfields is such a vast area to cover that sometimes it's quite difficult to bring people together. So for that event, we hired minibuses and picked people up from all over the coalfields area. We had Sunderland Recovery College attend that, and they did a song for us. It was brilliant. We had a group of 5-year-olds from a nursery come to that. We had a group of teenagers from the comp. We had a group of males from Shiny Row. We had a group from Lower Moseley, and we arranged the transport to pick them up. You know, they're going to get their lunch and then take them back. They were all people that lived in the area, but just to let them know what's going on their front door. We then made sure that we invited all the partners to have stands so that they could actually promote what they did. And it was just great bringing young people and older people together. It was amazing. We've got some brilliant photos, and at the end of the project we will do a report on it, because we've got pictures of like a man who was 95 dancing with a 4-year-old to a silent disco.
Yes,
it was really good, and these are the connections that we're missing along, and I think we will get them back.
Yes.
I mean, I don't know if you're experiencing it yourself with your neighbours, but our neighbours are out every Thursday, and I'm hoping that we can have a VE party in the street on Friday.
Yeah.
I should have really told them last Thursday, but I forgot about it, so I'll have to tell them this Thursday, which is the next day. So. You know, but I think that this COVID-19 will bring us back closer together and let us, you know, not forget that we are human beings, and we should all be sticking together. And I think that neighbourliness has gone, but I think we're getting it back with this experience.
I think that's right. I think there's an opportunity to recognise at this time what's really important, isn't it? And actually, to be fair to you, Jackie, one of the things that struck me when I started working with you, you were somebody who understood the issues around isolation and how it affects people, both, you know, in all kinds of ways, especially in mental health, and that's something which I know that you have experience of and understand. One of the things I am
really passionate about mental health, and I just think that anybody that says that they haven't had it are telling lies, because we all have mental health. It's about looking after it. Yeah. We have to look after ourselves. And this is a test for this COVID-19, that we need to look after our mental health, because, you know, I don't want to go out for a walk every day, but I force myself to, because it's good for me. It makes me feel better when I come back, you know. So we just need to look after ourselves, and whether that's doing mindfulness. I wasn't reading the first 4 weeks when they started, and that's when I know that I'm stressed, because I wasn't reading. I've read 2 books since last week, so I know that I'm now filled out.
But yes, that's right. I would call, so what you did, I mean, to some extent, what you're talking about there is about putting in place the things that are necessary to keep yourself well, isn't it?
Yeah, definitely.
And that's something we can learn together. And it's part of what the whole Recovery College is about, isn't it? And,
yeah, definitely, yeah. And I mean, I'm doing mindfulness every night. I never used to do it every night, but I know I need to do it so that I can settle my mind before I go to sleep. Because if I don't, I might not be able to get to sleep. But I mean, I don't even. I think a lot of people are experiencing it, but I've been having a lot of very weird dreams. And I think a lot of people are experiencing it, because I spoke to a few colleagues. I mean, really bizarre, you know, and it's because of what's going on. So subconsciously, we're processing it. Yeah. But like I said, I knew I wasn't right, because I'd never read a book, and like I've read 2. two in about 4 days, so I know I'm all right again now. So keep looking after ourselves.
I think that's right. I mean, is there anything you'd like to say particularly to people who are watching this on the Recovery College website? Is there anything reflections you'd like to share with them at all? Just
not to forget to look after yourself, you know, because we need to look after ourselves, especially our mental health. So our physical health, yeah, that's important, but our mental health affects our physical health. So if we don't look after our mental health, then how are we going to get through what's going on, you know? And if that means reading, so I sometimes I want to read all day. If that means reading all day, or not getting out your jammies, or, you know, because I don't want to go for a walk every day, but I do force myself, because I know that exercise is good as well. But I would just promote the 5 ways for wellbeing. If you can do the 5 ways for wellbeing every day, then look after yourself. You want to see my garden, since my garden. I've got a backyard. Right. My husband's been growing loads of flowers, and I keep them going out, you know, and taking notice and going, oh, look at them. So if you do the 5 ways for wellbeing, I think you'll be okay. Yeah. Because, you know, it is evidence-based. You know, it is evidence-based that if you do them 5 things a day, you do stay well. Yeah. You know, and that's all I would say. Do the 5 ways for wellbeing. That would be my recommendation. And if people don't know what they are, I bet I won't be able to remember them. No, take notice. Yeah. So that's taking notice of the seasons, or looking at the flowers. Yeah. Giving somebody a smile, or maybe giving an hour volunteering, like I'm doing myself. Be active, so going out for my walk, even though I don't want to all the time. Although I did 7 miles yesterday with my husband, my legs were killing me. In fact, when I woke up during the night, he said I was saying, oh, I'm tired. When I woke up during the night. So that's free. I bet I won't be able to remember. Yeah. Take notice, give, keep learning. Yes. So we're learning every day at work. Yeah. And what's the final one?
I can't remember. Is it saying being thankful? I don't know.
No, it's connect.
Connect.
Yeah. And that's what we're doing right now, aren't we? So even if you can only connect by a text, or by phone, or by Zoom, then do it, because it's good for you. You know, we've got our mother-in-law in a care home, and we have to do this with her online, because you can't go in a care home. No. So it's just, I think if you do the 5 ways for wellbeing, we'll get through this.
I think that's brilliant. Jackie, that's fantastic. I want to say to folks who are watching this, please keep in touch with what Jackie does, because she's got a real vision for Sunderland, and it's a vision which we all can take part in. And in the end, we're going to come out of this together, and we're going to celebrate together, and we're going to move forward.
And strong. Aye.
Brilliant.
All right.
Thanks a lot, Jackie.
Thank you.
See you again soon.
See you soon. Bye.
Bye.